You need to question, where's this Botox coming from and who's doing the prescription? Has it been bought off eBay, which I know happens?
Are we done with lip fillers? Are they out of fashion?
To look like you've had lip fillers is out of fashion. I think before it was quite trendy. Kylie Jenner made it really super popular back in the day. She got her lips done, obviously lip kit, etc. Now, lip fillers aren't out. It's just, if it's done well, you can't tell. So as we get older, from our 30s onwards, we're always losing hyaluronic acid, including in our lips. So in our skin, in our face, but also our lips. So our lips are naturally getting thinner from our late 20s onwards. So I always tell my patients, even if you don't want bigger lips, to maintain your own natural volume in your lips, you need to be thinking about a little bit of hyaluronic acid-based filler over the years. But it also depends on the product you're injecting and the injection technique and how you're doing it, because that makes a huge impact on how it looks.
Because there are lots of videos online of people actually removing the filler from their lips. I mean, is that something you'd recommend people doing at home?
So I think the idea of dissolving filler has become so kind of common and well known that people think it's like a quick fix. Dissolving filler is really complex. It's done with an enzyme called hyalase, which basically naturally dissolves the hyaluronic acid. Now, obviously, if you're injecting that, unless it's done under ultrasound guidance or specifically exactly where the filler is, there's such a large risk that you're going to dissolve your own natural hyaluronic acid in your face as well. So when you get into a cycle of dissolving and then you're going to have to refill, it just gets really complex. So please don't think, oh, I can get something done and then I can just get it dissolved, because when you get to something dissolved, you're most likely then going to have to refill something because you may have dissolved some of your own natural tissue. So it gets quite complicated.
Are lip fillers something that you recommend to your clients?
So it depends. So the way I do my consultations is I have kind of a very 360 approach. I always tell people there's no point putting stuff down here if the cover is dirty. So i.e. kind of your skin. So my go-to, my USP is skin, glowy skin. But I'm all about skin tightening, skin rejuvenation without jumping to kind of quick filler packages. Back in the day, a lot of cosmetic clinics were selling the Kylie package, the Kim Kardashian package, etc., to basically inject 5 to 7 syringes of filler to enhance and contour the face, including the lips. My approach is very different. It's, you have all the layers of the face, the bone, the muscle, the fat pads, the deep skin, the superficial skin. Rather than just thinking, I'll put Botox and fillers down here, think about the thickest layer of your face and work on that. And then you may never need the Botox and the fillers. So lip fillers, I do recommend when I think it will enhance kind of the facial proportions. So if someone has natural features such as a more prominent nose or a more prominent chin, then actually a little bit of lips can actually help the proportions of your face. So it's not to give them bigger lips, but it's to enhance almost the rest of their features, to balance their features.
So Botox.
Yeah.
Is Botox dangerous?
So Botox is kind of the brand name. So it's botulinum toxin A, and it's been around for decades. It's actually one of the most kind of well-known research products we use. It goes into the muscle and it stops the contraction of the muscle. Now, it works localized. It doesn't kind of spread. It goes into that muscle and stops it contracting, which by default, because your muscle isn't as active, will cosmetically soften your lines and wrinkles over time. It doesn't last very long, so it actually comes out of your system, most people by about 12 weeks, some people a bit longer, depending on your metabolism. So you metabolize it out. But the danger is if you do too much, too often, and start too young, because it's stopping the contraction of the muscle, your muscle isn't going to be as strong. You can imagine if you never used your calf muscles or you never walked or ran, your muscles would disintegrate. If you're bedbound because you're really unwell, you lose muscle mass. So if you're not using the muscle, it's going to get smaller. So it atrophies, which is the medical word for it. Now, if you have less and less muscle over time and you're never letting it re-strengthen, what happens is when you get 10 years down the line of doing Botox, your Botox doesn't really work anymore because there's no muscle to stop. So what happens is your skin, what the lines that people see is actually the collagen loss in their skin, which is causing that wrinkling. So that's why I always tell people it's combination approach. You don't just do something at the muscle layer, you have to work on the skin as well.
And what do you think about younger and younger people getting Botox?
So I personally have like a no under 25s rule in general in my clinic. It's not like a advertised rule. It's just, I don't really get them anyway, because I think the clientele that come to me are basically women like me. I think you get what you put out. Social media has made everything so visible. You know, you'd watch someone getting their eyebrows tinted, and now that's the same as someone getting a full face thread lift. You can see everything from start to finish. Back in the day, the cosmetic industry was almost like a secret black door of unknown what was happening behind the door, and it was for the rich and famous. Especially in the UK, it's become very affordable to be part of that world. Content-wise is so out there that you can see every procedure, which has almost normalized every procedure. So I think, unfortunately, the injectables side of beauty and cosmetics has become so accessible and people have seen it so much. So now I know a lot of patients that will go for their lashes done, and then in that appointment they've been offered by their beautician, do you want a bit of Botox whilst you're here? And they've just gone, yeah, okay. Whereas Botox is a prescription medication. It is literally prescription. It has to be prescribed by a doctor. And that doctor that's prescribed, or prescribing nurse or anyone with a prescribing license, but that person that's done that prescription for you needs to have assessed you. I need to have taken a medical history, make sure there's no contraindications. You haven't got any neurological conditions that, could affect it. If that isn't happening, you need to question, where's this Botox coming from and who's doing the prescription? Has it been bought off eBay, which I know happens? So there's a lot of really dangerous stuff that's being bought, and people don't understand the importance of that it's a prescription product.
So is that actually illegal for those beauticians to offer Botox to people if they can't prescribe it?
So to administer Botox, you don't have to be the prescriber. So you can administer it. However, the person that's prescribed it has the overall responsibility, because I've written that prescription in your name and said, that's for you, trusting that that person will obviously inject it for you. But they might do it for Sally and Jane and Sarah and, Steve. And I have, might not know. So that's where it goes wrong. So it is, however, in this country, we don't have regulations on, like, in depth. It's such a gray area. Doctors and nurses are regulated, and dentists are regulated by our regulatory boards. For non-medics, which actually make up about 80% of the industry in cosmetics, there's no regulatory board. So if something was to go wrong, actually, they're not accountable to anybody. And nobody's going to say, I'm going to take away your license and you can't do it anymore. They can just say, not my problem, go to hospital, go to a doctor.
In general, there are lots of kids nowadays using adult skincare products. What's your take on that?
Yes. Oh my God, Sephora Kids is trending on social media. Kids don't need active ingredients in skincare. All children need is, if anything, if they have dry skin, a good moisturizer to protect their skin barrier and sun cream. Children's skin, the barrier is sufficient enough because it hasn't been damaged by UV, by loss of collagen, by aging. So unless they have like a clinical skin condition, which very common in children is something like eczema, all they need is essentially SPF, like sun cream. When children go into their teenage years, when their hormones start changing, that's when they start to develop, skin conditions such as acne. That's the most common thing I see in, obviously, teenagers. The hormones change, you get more androgen hormones, so more male dominant hormones. That leads to more oil production. That then causes, more, your sebaceous glands produce more oils in your skin. That can cause inflammation, that can attract bacteria, and that's what causes spots. With that, then you need to start introducing ingredients which control oils. So you can start to introduce some small actives like a bit of salicylic acid in the routine to control that. But that should be guided again by doctors. You can start with things like that.
There's been a lot of coverage in the press about biohacking and billionaires, trying to fight aging. Is that something we should all be doing? Should we all be getting our skin lasered?
So, biohacking is going to be huge actually in the next few years, because I think people are going beyond just like kind of skin and face. And now people, I always say, you've got to think about hair body wellness. And there's no point looking good on the outside if you're not good on the inside. So biohacking is becoming really trendy. So this involves things like hyperbaric oxygen chamber, even like ozone therapy, and IV NAD. That's becoming huge. And it's all about kind of optimizing your health within. I know there was that Netflix documentary. What's it called? Like, I Won't Die or something, or like Don't Die. It's basically about a man that takes like 48 supplements every day and is doing all these things. Definitely that's something that's going to become more trendy. One thing in particular is actually, IV NAD is really important. So NAD is kind of a coenzyme that we have in our bodies, and it works in every cell of your body to basically generate ATP, which is like the energy source. So it literally makes your cells work. Now, we know that by the age we're 40, we've depleted half of our NAD in our bodies. So in simple terms, all our cells in our body is functioning half as well as it was than when we were like 20 years old. So what happens is we don't sleep as well. We get our gut starts acting up. We don't absorb things properly. Our concentration goes. We get foggy brains. We rely on caffeine. We rely on all these external kind of stimulants. It's just not functioning well. So the idea is if you restore your NAD supplies, so you literally just top them up, in a sense, it's all your cells are going to start functioning more optimally. So in a way, you feel like you're a 20-year-old again. So people say they sleep better, they have more energy, their metabolism's faster, they lose weight quicker, they're more, they concentrate. So all these like CEOs and celebrities, etc., they're in these kind of fast-paced jobs. They actually rely on like monthly NAD maintenance because they says it just keeps them working at their optimal. So that's going to become huge in the next year. But that's kind of the most popular element of biohacking. But yeah, it's all about making your cells work better and actually focusing on what's on the inside.
There are a lot of skincare trends that involve using animal sperm. Do you recommend these?
Everyone will have known it's like the salmon sperm facial. Kim Kardashian made it famous. So it's not a facial. It's in the UK, it's an injectable. In America, it's a facial because their rules are different. They're not allowed to inject it. So they have to kind of microneedle it or use it topically, which is why it's referred to as the salmon sperm facial. Essentially what it is it's DNA fragments. They come from trout or salmon gonads, and then they're obviously processed in laboratories. And it's a form of, marine collagen. Marine collagen is the best type of collagen for our skin. So they found a way where we can inject it. So it's a biostimulator. So whatever cell you inject it into, it stimulates. So if you inject it into your skin, it stimulates your skin cells to do what they're meant to. So to produce collagen, to produce elastin, to produce fibroblasts. So it makes them work. So you get skin again, but 5-10 years ago. So it becomes more elastic, it becomes brighter, tighter. Equally, people inject it in their hair because, again, it stimulates hair follicles. It's on that spectrum of stem cells and things like that. So again, we're getting more regenerative in our treatments. But yeah, they will continue to become very popular.
And talk to me about face taping.
It's like a trend on TikTok. So what people are doing is, instead of Botox, because there's obviously a lot of people that are anti-injecting anything into their faces, they're saying, oh, I get the same effects as Botox from taping my face. Now, what they're doing is they're literally putting strips of tape in all the areas where we have muscle movement. The idea behind it is, so when you sleep, obviously when we sleep, our face does wrinkle. So it's, it's pressing against the pillow, it's moving, we're moving it. We're not obviously, some people frown in their sleep, but the idea is if you kind of tape the muscle down, then I guess you're not going to crease it against pillows. That's the idea behind it. But I've also seen like mouth taping, because the idea is it gives you more snatched jawline, because then you're not mouth breathing and it's forcing you to like tighten your jawline, which again is a load of rubbish, but people love it.
What do you think is the one thing that everyone has to do to their skin to look healthy?
Avoid sun exposure. Like 100%, the number one thing that ages people is sun exposure. Like it just contributes to fine lines, wrinkles, sun damage, pigmentation, loss of collagen, laxity, and obviously skin cancer goes without saying. Wear SPF 50 or above. There's this picture that went viral many years ago, and it's of two twins, I think. One that wore like SPF and one that didn't. Obviously one, by the time that they're like 50 years old, you can just see one looks significantly like aged. And the other one obviously has like, good quality skin. So yeah, SPF makes a huge difference.
And this is all year round?
Yes, all year round, because you still get UV, even like through windows. And I always tell people, it's not about the heat, it's not about the sun. Some people go, oh, it's only like 19 degrees or it's only 20 degrees, but it might be like a clear sunny day. But you have to look at the UV index, because sometimes even if it's only 21 degrees, the UV index is like 7 or 8. So actually you're getting sun damage.
And other than sun exposure, what are the most common mistakes people make with their skincare?
Is to use too many things. There's been a real shift since COVID, actually. I think because we were all at home, and then that was the era when TikTok blew up as well in 2020. Everyone's kind of got into, get unready with me, do my skincare. And it's almost been that form of self-care. It's that 20 minutes of the day that you have with yourself where you can really kind of sit, reflect, have your me time. And what's happened is I think people have got too into it and think they need to layer their face with about 11 different actives. And a lot of the time, you're wasting so much money. I always say to people, know what your skin diagnosis is, like understand it, go to someone who can tell you. And then, what I tell people is it's my job to know what ingredients you need. And therefore that leads me to what products you need. But usually I say to people, you need 1 or 2 like actual actives that are going to change your skin. And the rest, you just keep it really simple. So skincare plans do not have to be elaborate or expensive.
And what are the worst plastic surgery mistakes you've seen?
So actually, not plastic. So one of the worst things that I really hope just gets, taken out of the cosmetic industry. So it's not necessarily plastic surgery, but it's thread lifts. Now, some people really like them. So basically what it is you put threads into the fat pads of your face, and it creates almost like a non-surgical facelift. So its aim is to kind of lift the face through going into fat pads. And that thread that goes into your face, it almost creates, it's meant to create kind of collagen and fibroblasts where it is, and it naturally dissolves. There's been obviously some studies to show it can create a bit of scarring, which is the reason it kind of holds the face up. But what we've seen is basically just a lot of complications. You get a higher rate of infection. They don't last. So people end up spending thousands, sometimes £5,000 to £8,000 for threads in their face. And after 3 to 6 months, they've dropped. Weirdly, facelifts surgically, I think, are going to become much more popular, especially because of so a lot of Hollywood A-listers have recently had their kind of transformations of all filler out and just facelifts. That's going to become more normalized. But in terms of plastic surgery, I think the BBL days are over. I think people are now just here to embrace their natural figures, because it's just high rate of infection, high risk. Again, whatever happens surgically is going to happen non-surgically. So if BBLs are happening in obviously a sterile environment in a theatre by a plastic surgeon, as we've seen in the press recently, there will be, unfortunately, a beautician that will then think, well, I could do that in my clinic. No, we're losing our thoughts here. That's not possible. We shouldn't be doing that. So I think, unfortunately, the more things that become normalized surgically are going to become normalized non-surgically. So we're all connected. So we have to be aware of everything.